before we move on to the presenters today, and we're very pleased to have a former CQC inspector now working for Fulcrum with us today, who can give lots of advice and points. As Dudley mentioned, we meet regularly, or I meet regularly with CQC, and Dudley and I had a meeting a couple of weeks ago with James Bullion and the London lead, and we've pretty much got them booked to come to an event in the new year for us. Now, the way that CQC operate is a mess at the moment because of the portal not functioning, etc. And you could all be experiencing issues here. If you are struggling to pay your annual fees to CQC, please do not ignore this. It could result, if you don't pay, you could actually lose your registration. If you find that you haven't paid or you cannot pay, then please contact CQC by email or by letter to point this out to them. They actually outsource their finance department, so they don't seem to know quite what's going on with it, which may seem a bit odd, but there you go. Also, CQC can only change the way that they inspect, basically by almost an act of parliament. But they are doing a number of pilot schemes at the moment to try different ways of inspecting. And if you are inspected or due to be inspected, if you can give us any feedback, then obviously this will be confidential. This is useful to us to put together and help other providers. There are a couple of things at the moment that are causing a lot of concern, and they're not new. And one is falls, and that seems to go around cyclically. Every couple of years we have something raised about falls. We've got some parties saying that falls are unimportant, and that they don't really count. Whereas we've got other parts of local authorities, safeguarding, etc., saying, and the NHS saying that falls are a measure of the competence of social care providers. So my thoughts on this are that you need to be diligent. You need to record everything. Evidence is absolutely sacrosanct. And if you've got some issues around falls, then please talk to Dudley and myself, and we can actually put together, we've looked at putting together a meeting around this, because it's one of those things that comes and goes all the time. Also, fees. Local authorities are trying to force fees down. If you're having a problem, again, please let us know. I've had a contact this morning from somebody who hasn't been paid for months, and there's one client, the council are trying to force the dom care provider to move on to a direct payments. He's resisting this, so they've simply ceased to pay all his bills. So that company has had no fee payment from the local authority for several months now, and they're basically refusing to talk about it, and they're just wanting to force him to do their way. And of course, direct payments are a couple of pounds an hour less than the normal fees. So it saves the local authority money. So if you've got any issues around that, again, please let us know. And there is LCAS is part of the Care Association Alliance, a national body, and we're putting together a national fee chart, because we're in contact with CQC, with the DH, and with ADAS. And there's an awful lot of problems money-wise. Many of us know about that with local authorities, but we need to get some bulk. We need to be able to go to the DH, to go to MPs, and get your local MPs involved. Tell them what a shambles the local authorities are making of the job, and the fact that the NHS is not playing ball. People think the NHS is perfect, and it isn't, and we know that. Dudley's mentioned staffing issues with sponsored in particular. Again, we've been on working with the UKVI and the Home Office to try and get them to come up with a set of criteria. This apparently has yet to be signed off at senior level. We've been promised this for months with very little happening. And one final thing before we move on to Fulcrum. Have any of you been under pressure from local authorities around climate issues, environmental issues? This is a big issue coming forward with 2030, 2050, for local authorities. And they're pushing it down to small providers. It's very, very difficult for providers to actually do anything about this. And you may find that if you've got the opportunity to get an ISO standard, that will help you. But again, let us know, and we can try and put something together on it, because it's a very, very difficult area for small providers, small companies, full stop, to get involved with. That I think is fine. What I'd like to do now is to move on to Fulcrum, to James Bannon, who I think is with us.
Okay, before I go, just to let you know, this is the agenda, everyone, so that you're clear and those speakers as well can understand. So we've had our intro. Fulcrum are gonna be next, and then we're gonna go into Unison. We're gonna get some feedback interaction from yourselves, just really about what you're saying. We've got me, Passport, and Tern as well, and then an LCAS roundup. So hopefully it should be will go very well. But please use the chat box at any time if you want to ask any questions. The speakers are obviously dropping information in there as well. And thank you, and hope you enjoy the session. You're on mute, Peter.
Any more? James, good morning. Welcome. I can see your happy smiling face.
Good morning.
So the screen is yours, sir. If you're co-host, so you can put up any slides, and off we go.
Wonderful. Let me just see if this will work for me. Should do, considering I own an IT company. So, thanks. Just doing some permissions because I'm on a Mac. Okay.
But Dudley could guide you through that because he's a Mac lover.
Oh,
yeah. I'm a Mac person as well, and also the thing that throws people as well is Zoom is sometimes different for Teams, but you seem to have, yeah, we're in there.
Yeah. Okay, so you should be able now to see the screen. In terms of, is that right? Can you see the screen, everyone?
Yeah, you might want to go rather than presenter mode, because we can see. I mean, you can go the other way to the full screen, yeah, slideshow.
Oh,
Yeah, you've gone back to that one. There you go. You just won't be able to see us, but we should be fine.
perfect. So hi everyone. For those of you who don't know me,
sorry, you're still on. We can still see the sides, so you might want to go to play from the first box. Play from there, that one there. Well, I don't know why.
You see that now?
That's it.
Perfect. Sorry, you've just disappeared. So let me just move you here. Fabulous. So, hi everyone. I'm James, and I'm from Fulcrum Care. Just a little bit about my background for those of you who may not have heard from the introduction is I'm a quality consultant with a company called Fulcrum Care, and we provide a wide range of quality solutions to care providers up and down the UK. As you can probably tell from my broad accent, I'm from Manchester, so I'm based in the Manchester region, in Manchester, and I was in Manchester team 2 when I was in the CQC. So I was a CQC Inspector. I left the CQC in April of this year. Due to a number of reasons internally around single assessment approach framework and the support that I felt that we were not providing to the providers, and that lack of relationship that we'd lost, which was really important to me as an inspector when I was based within Manchester. I'm one of the lucky ones, one of the lucky inspectors who managed to get their training in the single assessment framework. So I spend the majority of my time at the moment completing single assessment framework mock inspections, essentially. Just going to do a couple of things today around systems and processes in preparing for a CQC assessment. And then there's some question time as well within this. So again, if you've got any burning questions around single assessment framework or anything to do with the CQC, I'm more than happy to listen. this is some of the stuff that we do. We do a lot of turnaround work. We do mock inspections. We do mini remote inspections, quality audits, registration support. So we do a wide range of services. And one thing that we have found through our work is that um, the challenges are getting more complex and numerous. And I don't need to talk to you about this. You know, we are all, you know, privy to what's going on at the CQC. We're all aware of the changes. The regulatory landscapes of the switch from the old way of working using employees. The single assessment framework has been a challenge. Um, and growing demand for services, which I feel is almost a good thing because people are living longer, and you know people are accessing services for longer because they're having longer, healthier lives. But that also naturally increases the demand for services. And then there's a shift in workforce dynamic, and wherever I go in the country, I was in Dover the other week, and I was in Liverpool last week. So I'm all over the country, and it's the same around workforce dynamics. People are not wanting to work in care anymore. We're having an increased number of sponsorship staff working in the country, which is really backfilling them posts and providing that care and support. Understanding these areas is the key to adapting and thriving. So obviously we've talked about the changes to the CQC inspection regime coupled with a lack of recent inspections leading to many providers being ill prepared for inspection. What I will say is from my perspective and from many of my colleagues' perspectives is that the information that the CQC are going to request from you is going to be the same. So the list of documents that I would ask for as a CQC inspector is the same. Fundamentally, it's the regulator's approach to that information that's changed and how you are aware and embedding of the new single assessment framework and the I and the we statements. But fundamentally, the information doesn't change. Your care plans are still your care plans, your recruitment files are still your recruitment files, and the documents that you need to provide are going to be the same. Whilst there's no public and political recognition of the failings of the CQC, and the plans to reform the CQC's approach, further changes are unknown. I know that from internal comms, because I still retain a bank CQC inspector position, that they are planning to reduce the number of quality statements within the single assessment framework. However, we don't quite know what that looks like yet. There's a big piece of work going on in terms of that. The findings of the DASH report. So if you haven't had a read of the DASH report, it was a report completed by Dr. Penny Dash. She's chair of North London ICB. And her report is leading to significant changes being implemented. So if you look at the report, she makes a number of recommendations, and all of the recommendations made by Dr. Penny Dash have been accepted in full. So it's really important that we recognise that all of them changes that you are seeing written down are going to be implemented. Sir Julian Hartley has been appointed as CEO and commences his role in December 2024, so this month. And then there's going to be 4 chief inspectors. So we're going back to a sector-based chief inspector who will have specialist knowledge, which will be able to drive the single assessment framework. And as I've said there briefly, CQC are also reviewing the current assessment process, and they're updating their approach to relationship management. So as I was an inspector in December of last year, I lost all of my relationships that I built with my services. I looked after 53 services, which was a mix of learning disability care homes, nursing homes, and domiciliary cares, shared lives. I lost all of my relationships with my services, and then I moved to managing across a team of multi-inspectors, so a team of GP inspectors, mental health and hospital. I then moved to managing around 300 providers between me and my colleague. We couldn't form meaningful relationships with them 300. We were covering duty between us, as well as managing notifications, as well as managing specific incidents. They are at the moment trialing in a number of areas in the country a return back to how it used to be in terms of relationship management. So you having a named inspector that if you had any problems or you had any comments or you had any concerns or you had any questions, you could pick up the phone, drop them an email, and have that really good relationship where you understood each other. And then hopefully that will then feed back through to that assessment process. One thing I found is I inspected my own services when I was an inspector. So the 53 services that I looked after, I inspected. So most of my services already knew me before I went in, which was good because there wasn't this fear. It's somebody unknown. I don't know how they work. We'd had that relationship before. We'd worked on how we were going to develop that. So there wasn't that fear when I walked through the door. Whereas now you have no idea who's going to walk through that door. You may know them, you may not know them. So again, they are looking to return back to this. Pressing issues. So this is registration figures. So you can see here we've got two columns. Obviously, one is home care, dom care, and one is care homes. You'll see that outstanding is 572 and 444. It's harder to get outstanding than it is for you to get inadequate. And what I mean by that is I took two services to notice of proposal to close, and I took two services to outstanding provider panel. Both of the services that I took to notice of proposal went through and were closed because of what we'd seen and the harm that was being happening. However, both of the services that I took to outstanding providers, which were outstanding, were not given. So that was a real frustration for me as an inspector, because outstanding is very, very hard to get. Under the new single assessment framework, obviously you'll get a score, and that score will tell you how far or close you are to a particular rating. So when you have good, obviously good is now a range, so you will know how far you are away from getting outstanding or how far away you are from dropping into that requires improvement. You'll see the majority of services in the country are good, and a large number of services that requires improvement. From my experience, these numbers here around requires improvement are actually probably good providers, but just haven't been inspected. So what I was finding is if you're a requires improvement service and you had not had a huge amount of notifications, there was no safeguardings, you essentially weren't doing any red flags because you've made the improvements following your last inspection, you sort of got left. So there's a large number of required improvement services that aren't being tackled because the CQC changed its approach during the coronavirus pandemic to only approach risk. So when you're approaching risk and you're looking at services that aren't doing red flags, there's not a huge reason for us to be getting out there because we're not concerned. And the starkest number, I think, here when you're looking at these registrations is the numbers of services that aren't inspected, so they're not rated. So we've got 5,700, I'm going to call it 5,800 services, and that are providing domiciliary care that haven't been rated by the CQC, and you've got around 1,500 which care homes which haven't been regulated or assessed under and given a score. These numbers are contributed to a lot of sale and transfer. So when a provider sells a service to another provider, obviously the new provider hasn't been inspected, but the service retains its old inspection. But it in theory goes down on the system is not rated because the new provider hasn't been. However, these are stark numbers because what we have here is we have 200 services which are inadequate, which need to be inspected every 6 months. And we've got 4,000-ish services or just under services that requires improvement that need that re-inspection. And then you've got probably 6,000 or 7,000 services that need an initial inspection. So the CQC has a mammoth task in terms of getting through these inspections and getting people back to where we should be, which is good. Um, when we've done some analysis, many care providers face the same difficulties, which regulatory demands. So there's a lack of consistency in care delivery, insufficient staff training and oversight, a lack of clear systems and processes, poor record keeping. I always say this is, if it's not written down, it didn't happen, and inadequate governance structures. So we looked at key themes and issues across several requires improvement in adequate rated homes recently. Staffing issues. So many inadequate and requires improvement homes struggle with staffing, both in terms of the quantity and the quality. So there's a two-pronged approach there. And this includes insufficient staff numbers to meet residents' needs and a lack of proper training and qualifications. So it's really important that when you are setting up a service, particularly for care homes, that you have a system in place that tells you how many staff you need to meet your residents' need. Management and leadership deficiencies. So we have poor management and weak leadership. Services have gone through changes. Experienced managers, registered managers are leaving the industry in swathes. And that's leading to a requirement to upskill deputies and upskill seniors into these leadership roles. Most of the time that I find, it's not a lack of care or a lack of approach. What it is for them individuals is a lack of training around the regulatory approach. So what the CQC expectations are, and that support that comes from that having a mentor or a key person. Non-compliance with safety standards, so essential safety standards, medication management, preparedness, and safety protocols. So, one of the easiest breaches to have is for health and safety for a care home. Pat testing, gas safety, all of these mandatory checks in electrical installation condition report. The CQC has a list, and we'll look through that list to make sure that then statutory checks have completed because it has delegated authority from the HSE for health and safety in care homes. It's one of the easiest breaches to give when I was an inspector because it's very black and white. The law says you must do this, you haven't done it, therefore it's a breach of regulation. Inadequate resident care. I see this significantly less. I don't, when I go out and I look at reports and I look at reports that are coming out all of the time, I am seeing that caring is usually good. It's very rare that you see caring dropped to inadequate. Usually it's safe and well led, but care it still needs to be important and it needs to feed through that care planning around that person-centered care planning. And then regulatory enforcement actions. So if you have got enforcement or you have had a bad inspection, it's about how you respond to that in a really robust way, sending them action plans and then preparing for them to come back out, knocking on that door and saying, we are ready for you to come back. Failing to meet the CQC standards and being unable to evidence that you're meeting the quality statements can lead to poor inspection outcomes, reputational damage, and operational difficulties. We recommend that you take a proactive approach, conducting regular internal audits and mock inspections for continuous proving. If you're part of a group, go and inspect each other's homes. I think, services like ourselves provide a mock inspection service, but if you're part of a group and you've got 2 or 3 homes, go and have a look around each other's homes. Go and have a look because sometimes when you're in that environment, you don't see some of the things that you might see if you go to a different service because you're in that environment, you're embedded into it. Stage manager inspection, be prepared, provide coaching and mentoring for your team. Most of the time, when I saw bad practice, so if I saw like bad moving and handling, it wouldn't be because I thought that there was a huge moving and handling issue at a service. Most of the time, it was because I was stood there watching them, and their response to me, nervous, on edge, scared, worried about making mistakes. So it's really important that you support that team with that coaching and that mentoring, get them ready. And when the CQC arrives, I always say start with, thank you so much for coming. I can't wait to show you all of the great things that we're doing at this service. Set that expectation with the CQC really early on, because it really brightens that inspection up. And by lunchtime, they're going to be saying, oh, so what are the other great things that you do? Stage manage this inspection. This is your inspection. This is your chance to give them all of the evidence that you've got that you are meeting the standards and excelling them. Thorough documentation. So again, I've talked about this around if it's not written down, it hasn't happened. And then crisis management. So developing a robust response to quickly address and rectify any issues. If you do need to engage external help, to reassure the regulators, again, make sure you have a plan to do this. Values and visions are really important. So if you look at most of the CQC reports recently, they are referencing, does the service have values and vision, and how the staff embedding that. Effective governance is at the heart of any well-run service. So again, making sure that the structures can ensure that care providers meet the regulatory obligations. Clear roles and responsibilities, make sure everyone knows what they're doing and what happens on an inspection. The thing that used to make me laugh when I was an inspector is I would arrive on site, and most of the time within an hour, a full regional suite of people would arrive, the owners, regional managers, operations managers, HR managers. Again, just be aware. We want to support the registered manager and the nominated individual in this inspection process. That regional team needs to come and bolster your registered manager and that service. They need to come and provide that support. And the CQC will be very interested in seeing how you provide that support to the manager. This is their inspection. This is their home. We want you to wrap around them and making sure that it's really clear that you're not there to take over if you are part of a regional team, and that you are there just to support the inspection. Effective communication, so making sure that you've got effective communication. This is very simple, but making sure that you're minuting staff meetings, making sure that if you've had group supervision because something might have gone wrong, beginning to do a lessons learned, making sure that you're documenting that, getting staff to evidence that you are doing these conversations. And data driven, so utilising technology to collect and analyse data and outcomes to spot trends and areas of improvement. If you are using an electronic care system, something like PCS or WeCare, there's loads of different ones out there. A lot of them will provide you with that data that you need in terms of being able to provide them reports and how you can improve and drive down numbers. These are some options that you've got that are around to improve governance and oversight. I would say review your workplace culture. So there's a culture toolkit activities on skills for care. Again, we'll share this presentation after. But do a culture toolkit. See what the culture is like at your service. Do a culture toolkit with night staff. The worst thing that can happen for you as a service is that CQC come and then they say that they see elements of a closed culture. Evaluate your recruitment process. Are you doing value-based recruitment? How will you get into the crux of what the staff are saying in their interviews? Speaking up. So again, creating an open and honest culture, transparency. We can only improve and change if people tell us when something is wrong. Develop a culture where people feel that they can do that. Evidence and plan your action plans. So having an action plan, one of the first things that CQC is going to say to you is, have you got an action plan? Are you things from your audits? So are you seeing something in meds in your audits? Are you feeding that through to an action plan? And then growing together. So there's some quality improvement films and resources for care home staff from the React to company. Again, we'll send these links out as part of this. Overcoming regulatory challenges, implement consistent standards, continuous staff development. So making sure that your staff are developed, strategic compliance planning. So embedding that compliance within your culture and your strong leadership. And that will really upskill your managers or yourselves. And then governance and oversight. So making sure that there's really clear oversight within your governance systems and your audits to make sure that everything is feeding in. This is what an audit's, we talk about, you said we did. Your audits also need to mirror this. The audit said this is what we've done about it, and being really clear how you've evidenced that. Because you're going to have med errors, you're going to have recruitment issues, you're going to have incidents, you're going to have falls. This is human nature. We are dealing with humans. What the regulator is bothered about is how you respond and learn from these. So that's the difference. And having a really robust governance system will allow you to do that. Just some options here around enhancing safe and effective care. So accessing your local safeguarding boards, accessing your ICB medication management. So again, I travel across the country, like I said, Dover, Liverpool, Kent, Southampton, I think it was the other week. ICB medication management policies are different everywhere. So making sure that you are following what your local ICB is saying around medicines. Align your audits to best practice, so nice guidelines and that your MAR systems. So again, if you're using like a multi-compliance aid, so a DOSIT box, try and, if we can, move away from stuff like that, because nice guidance is that that's not the best way to support somebody with the medication. But most importantly, involve people in the process. If you're thinking of changing something in your service, consult the people who live there, who work there, and who visit there. They're the three important people that you really need to embed in any changes that you're planning on making. How do you enhance effective? So follow guidance set out. So the MCA Code of Practice. MCA's mental capacity assessments should never just be yes and no answers. Prior to me joining the CQC, I oversaw mental capacity acts for one of the largest NHS trusts in England. And you cannot simply just write yes and no. Does William understand? Yes. No, explain why that you've reached that decision. Explain what you've gone through in that process to get to them being able to either weigh up or understand the decision that's being made. You need to evidence that because the CQC will look for that. And I've seen breaches to consent for that. Create a comprehensive assessment process that marries to your organisational religion values. So again, making sure that your audits align to your visions and your values. And again, this is the important bit, again, involving people in decisions and plans about their care. The people who live there, the people who work there, and the people who visit there, making sure that they're all involved in the person's care. Transforming care quality that involves more than just meeting the minimum standards. It's about striving for the excellence. So this is what we're trying to do. Don't aim for good, always aim for outstanding. When they turn up, provide them with everything that you've got to be able to really show that you are innovative, you are challenging, you are improving the care that you are providing. Innovative training programs, so comprehensive training programs to empower staff and with the best possible outcomes. You have really good upskilled staff. The people in your care will be well looked after. You invest and develop in your staff. Quality assurance systems, so we've talked about this again and again and again. Implementing robust quality systems, gathering feedback. You said we did. That is a really strong approach. Listening to people's feedback and then empowering staff. But in fostering your culture where your staff feel valued, supported, and motivated to contribute to the care. If staff feel happy and staff are acknowledged, they will provide good care for you. Building resilience. In an environment of constant regulatory challenges, building resilience is essential. Adapts to change, so sign up for the multiple newsletters that the CQC do. Listen to what the CQC are saying, listen to what the Department of Health are saying, listen to what your local groups are saying, and be involved in that, when they are sending out the questionnaires about the change and stuff. Make sure that you can contribute to that. Investing in a workforce development. As I said, multiple times, a well-trained and supported workforce is the foundation to your resilient care service. And then operational effectiveness and resource management. So again, a focus on ensuring that operational efficiencies are well managed to maximise your commercial results, because it allows you to weather them external pressures and maintain a quality of service. You know, if you are a good service and you have really good relationships with your commissioners, you will be commercially well managed. Granted, there's some issues with local authorities paying and all of them issues, but if you are a good service, commissioners are more likely to commission with you. Okay, and then resources. So again, we'll send this out so you get the links, but you can see here that there's some resources that we would recommend having a read of. So obviously the CQC's website, we have to point them to that. Fulcrum. So again, we do some regular insights, and then I think if you do one thing today, read the response to the Dash review, so that you can understand what changes are likely to come to the CQC, and get ahead of the curve. I don't think the single assessment framework is going to go. I do think it's going to be modified and made more sector specific. So I feel that that's where we're going to go with it, but I don't think the single assessment framework is going to go. Thank you very much for your time this morning. If you've got any questions, I'm more than happy to take them.
Thank you very much for that, James. It was a very comprehensive update. I guess it's been a very interesting 12 months with CQC, but unfortunately it has really left a lot of providers scratching their head of what works in different parts of the country, can bring different results. That personal touch of inspectors is now, like, people like yourselves having gone as well.
Yeah.
And
I think-
obviously they were looking to have a system in place, weren't they? And that system now, unfortunately, 93 million plus has not really been effective, sadly.
Yeah, and I think if you actually look at the Hansard from Parliament, the CQC aren't share where the 92 million pounds has gone. They can't provide a breakdown to Parliament of where the money's been spent, which is a sad shame, to be fair, because it's a lot of money, and there's been a huge delay in the last probably 6 months in terms of reports going out. So I've been supporting some services that have been inspected in June and July, who are still waiting for their inspection to go public because of the regulatory platform not being able to publish the report. So there's an issue with reports being able to be published and people and providers waiting 6 months nearly to find out what their report's going to look like after factual accuracy. So it's a huge stress for providers waiting.
I mean, I'll leave anyone who wants to put a question either in the chat box, or they can raise their hand and we can and then they can actually ask the question. And one thing I also will say, and it's glad you're here, James, and this is to do more that CQC and we've spoken to them directly, are looking to ramp up inspections to play catch up with obviously being behind. So I think outside of obviously the issues around the rights and wrongs of CQC, they will be inspecting more regularly at the moment. So for those looking from their compliance, looking at elements around their service, now would be a good time to really internally try and self-inspect, whether you're using Fulcrum or yourselves or another parties. Now would be a good time really to analyze that, because there's a good chance that CQC will come knocking sooner rather than later, and just getting yourself inspected ready, which you should do anyway, but more so.
And I think just to add to that, there's a huge amount of information and support in the presentation you just seen, but we can't be experts. We can't all be experts at absolutely everything. So many of you as care providers are very good at the care elements, but sometimes your acumen around business and administration let you down. So don't be afraid to talk to people like Fulcrum about how you can make your systems better. Sure, there may be a cost involved, but the costs are actually a lot less than the costs of getting something wrong with CQC. And it's very good for registered managers to have a shoulder, if you like, to cry on, someone to talk to, who may not be the owner of the business. A source of independent advice is very, very useful, and organizations like Fulcrum can provide that. And I can only, stress some of the points that that James has made. When we talk to CQC, things like training come up time and time again, poor quality training. I'll give you a link to John Buttle in the chat in a moment. If you're not yet accessing the DH money for training funding, talk to John, get on the case, get that organized. There are very simple things that CQC inspectors, as James has mentioned, are able to pull you up on. And we'll come back to digitization, I suspect, later in the event. And I think there's a question just popped up in the chat box, which Dudley may have already spotted. You're on mute.
I think I'll catch up. What constitutes strong governance structure, James? If you can maybe answer that. And it may not be a one-word answer, but I guess give you a general overview. Some bullet points might be helpful.
Yeah, so I think good governance, it starts at the top, and it comes from your NI and having that really good relationship. If you are an NI on the call, again, the key bit of advice is having that relationship and that link. So making sure that you are visiting your service and recording how you are doing that. So that's it. That's the important bit there, is around that record keeping, around how are you as an NI keeping in touch. It starts at the top. So obviously your registered manager obviously is responsible for implementing a good governance system. For me, a good governance system is set out what audits you're going to do, when you're going to do them over the course of the year, and then sticking to that. Because the amount of times I go into a service and they say, we're going to do medicines management audits every month, we're going to do CD checks every week, and then we're going to do a big full count every 3 months, per se. And then I go out when I'm like, we haven't done a medicines audit for 4 months. Because we all know that people get busy. We all know that people get waylaid by stuff like this. It's really clear, set out what you're going to do, when you're going to do it, and then the robustness. So I always say I have a live action plan. Any actions that come from any of your audits feed into this action plan. Once you've signed it off and you've gone, yeah, no, I've definitely done that, so I've definitely checked that off and minimized that, then being able then to take that off your action plan. So I would say have a live action plan, 2 tabs. One tab is live. What have you got on now? What's feeding in from your audits? And then archive. Once you've done that action, take it off your action plan, put it into your archive. So when the CQC says to you, 6 months ago in a medicines audit, you had a CD error. What did you do about it? You can go back to your action plan and say, this is what we did. We implemented training. We did this. We did this. You've really got a robust system to be able to go back and say, this is what we've done to minimize this from happening again. Good minutes. So I said before, around keeping minutes of meetings and minutes of staff training. Keeping minutes of shared group supervision. So group supervision is used a lot in care when you need to deliver a message, say something's gone wrong. So you're doing a lessons learned approach, and doing that, making sure it's minuted. Because the amount of times I would go and say, well, how have you learned from this incident? Doris has had a fall 6 months ago. Because we're going to go back. The CQC can't look forward. We can only go back. We're going to look back through your incidents. Okay, what did you do? What lessons did you learn? All right, well, we did this, we did this, we did this. We had a group supervision about observations, and this is the group supervision. Great, because that's good governance. You've tracked it, you've recorded it. And it always goes down to that. If it's not written down, it hasn't happened. And the CQC very much take that approach. If we ask for a document and you haven't got it or you haven't provided it, it will go down in the evidence files that you haven't got it. And depending on the quantity of documents that you haven't got, depends on whether or not you may tip into a breach in an area. So I think good governance, it starts at the top, really strong leadership team, really strong manager, setting out what you're going to do over the course of the year, and then following it up. I just can't emphasize that if you've written down on a piece of paper that you're going to do this audit, this audit, this audit, do them audits, because otherwise you've set yourself up to fail, because the CQC will come in and say, well, you said you're going to do this and you're not doing it yourself. So how can we have faith that you're going to provide other good governance areas? So I think they're the key areas.
Thanks for that, James. It looks like you've done so well. People are asking for your contact details in the chat box, so you're obviously doing something right. Just another thing to add as well, a lot of the time when I speak with providers, especially more smaller providers, they try to stick to these wonderful times that they say they're going to actually do their audits. But give yourself a window, because sometimes if on the day you said you haven't done it, they usually say we haven't done it, so it just gets put away. But if you give yourself a window, it means if it's not done, for example, on Monday, you've got a week to do it in that time. So don't be so hard on yourself. Actually give yourself sort of a little leeway so it still can be done as well. I think it's hugely important.
Yeah, there's not a set regulation that says you must do a meds audit on a Monday at the beginning of every month. It's for you to determine what's the best system for you as a service, and when that suits you. The thing is, if you're going to set that, like Douglas said there, make sure that you either set it through a period. So within the first week of the month, we want to do this, or we do this within the first 2 weeks. But if you are going to say you're going to do something, follow it up. That's just the biggest piece of advice, because it's so easy for the CQC to come in and say, well, you said you was going to do this and you just haven't done it. And then that will set the plate up for the rest of the inspection in terms of what they're looking for, because they're going to say, well, they say they do it, but they just don't do it. So it's like, okay, how do we get around that? So again, yeah, just making sure that you've got that completed.
I think
Thank you so much.
It's worth raising, James, is that when CQC raise a point, be it FACAC or anything else, they will give you whatever it is, 5 or 7 days to respond. So you dutifully respond within the time frame that they provide, and they then take 3 months to come back to you. By which time you've forgotten about it because you're running a business and you've got 4,000 other jobs to do at the same time. And they then say, oh, of course, you've not followed up. The fact is that you have followed up, but you haven't kept them informed because they've not kept their side of the bargain. And we have had a number of robust conversations with CQC that they should respond to providers within a set period of time. And their argument is, well, we can't do that because of our circumstances. Now, our argument, well, if you can't do it, then the providers can't do it because they've got circumstances too. But they just said no. And I think one of Trenome's problems, and the information that's coming out about CQC through Private Eye, which is worth subscribing to, folks, is quite interesting because they're not reacting to complaints from the general public. And they didn't like taking complaints, particularly about FACAC. And we had quite a lot of high-level legal advice about this. And the lawyers were getting very aerated about it because it was not fair and just. And so if there's an issue and you've done whatever you've done within the time frame, you will then, and James may have a view on this, it can then take quite a while for CQC to respond. But you need to keep, as has been said, make sure everything is written down. Every step, every tread is written down along the way. So when they come back to you in 2 or 3 months' time and go, oh, we've decided this, you go, hang on, because in the interim, when you've not come back to us and you've ignored us, this is what we've done.
I think so. So thank you very much for that, James. And as you said, once again, you can leave your information there. James will, you can get through to James by contacting us if you need to, any questions. their ongoing service, and they have a raft of mock inspections that they do within organizations. And they also help you. It's not just as a whole, but on just certain areas as well. So please do keep in touch with Fulcrum. They're a really great service in what they're doing as well.
And I think you will find with Fulcrum that if you have a query, give them a ring and they'll talk things through with you on the phone. They're happy to give you some time. And they've got lots of expertise, lots of people like James who've got a vast range of experience across social care. So don't waste that opportunity. Do give it a go.
Mm-hmm. Oh, and also as well, just to let you know, just because James was an ex-inspector doesn't mean he's not approachable now. He's now on our side, should we say? So there you go. Thank you very much, James. I'm not sure if Steph from Unison is here.
Yeah, I'm here.
Thank you, Steph. So thank you. We're now moving on, as I spoke earlier, about the care sector really coming together, and being a union is one way of doing it. There's a huge support for the care workers. I know as providers, you're so busy trying to manage services, but I always say, who's looking after those care workers on the ground? Where can they get support, advice, help, and so many things? So Unison are one area in which they can do it. So I'm going to let Steph, who's from Unison, just speak on the things they're doing to support the sector and the care workers itself. So thank you very much, Steph.
Thanks, Dudley, and thank you for inviting me. So yeah, hello everyone. My name is Steph Kearns and I'm the social care lead for Unison Greater London region. I'm really pleased to be here with you all this morning. I'm sure I've spoken to some of you before, but I'm gonna, as Dudley said, sort of cover what we're currently doing to support care members and what we're doing to improve what's happening currently within the sector by our campaigning. So Unison as a trade union, there are two strands to what we do. One is the representation, supporting individual members within the workplace. And then we also campaign, negotiate and bargain to improve working conditions across the sector and within individual employers. Now, we have recognition agreements with local authorities and with the NHS, but many care providers that are privately run, we do not have recognition, so we don't collectively negotiate or bargain in those workplaces. However, we are currently working with the Government Department for Health and Social Care. So they're working very closely with Unison and also some of the other trade unions who represent care workers to discuss a fair pay agreement within social care. So what we're currently doing is putting together focus groups of care workers who are going to directly speak to colleagues from the Health and Social Care department about their experiences working in social care and what changes and improvements they want to see for care workers. We are also doing a migrant care workers survey to gain feedback from our migrant care members about what challenges they're experiencing in the sector and in the workplace. So that we can directly feed that back to those that make those decisions and set those policies to ensure that those workers are protected at work and treated fairly when they come to work in the UK and deliver vital care services. So care is a really fast growing area of our union at the moment. It is the fastest growing area of membership. We have over 12,000 members in care just in London, and our records show that the majority of these are migrant care workers. I think it's fair to say some of them are probably already fully familiar with what unions are when they come to the UK, but a lot of them are joining not because things are going well, but because things are not going so well, and they are looking for that support that they're maybe not getting elsewhere. So the support that we offer, I'm going to put some links in the chat box as well, but many of the care members that we support are not getting some of their basic rights in terms of contractual rights and statutory rights. Particularly in home care, we're seeing a lot more of these issues occurring, including breaches in working time regulations. So this is what a worker is entitled to in terms of daily rest and weekly rest and time off between shifts. And what we're seeing is that a lot of members are not getting their basic legal minimum breaks between shifts or during the day or in each week. And obviously that is a huge concern, because it leaves the employer open to potential legal claims for breaching those regulations, but also it leads to a higher risk of those workers having accidents, injuries, and generally getting burnt out and not feeling motivated at work because they're not getting adequate rest and breaks. The other issue that is happening a lot in home care is members not getting at least minimum wage. As you all know, minimum wage is going to be going up, and it is the legal minimum that they receive at least £11.44 per hour. Some employers, which we're very pleased, are paying London Living Wage, and our hope would be that more employers would adopt London Living Wage, as evidence shows that workers who receive minimum wage are more likely to leave than workers who receive above minimum wage. So it is a key kind of retention. It impacts on retention there. So those that are not receiving minimum wage, it's not because their hourly rate isn't what it should be. It's because they're not being paid for their travel time. So between client to client, they're not being paid for that time that they are traveling. And some of them are spending several hours a day traveling between clients, and they're not being paid for that. They're only being paid for the time that they're actually with the service user. So in that respect, their pay would not be minimum wage because their travel time would be considered working time. They're also not necessarily being paid for the time that they are training as well. We've had reports from members that when they're training, they're getting a reduced rate of pay. Now, if it's mandatory training that they need to do to undertake their roles, such as safeguarding, we would say they need to still be paid at least minimum wage whilst they're doing that training. If it's optional, that's a different story. But if it's a mandatory training course that they're having to attend during working time in order to undertake their role, then they need to still be paid at least minimum wage. Sick pay is another one, and we know that a lot of employers are only paying the legal minimum of statutory sick pay. We would obviously support that members should be getting paid full occupational sick pay or above statutory sick pay. The issue with a lack of sick pay, there are currently 3 waiting days in which members don't have to be paid, depending on what their company's policy is. But what this leads to is presenteeism, so members working when they shouldn't be working, when they're sick, higher rates of accidents, injuries, burnout, long-term sickness, and staff turnover and shortages. So when members feel that they are in a difficult position, being forced to either come to work when they're sick or stay home and then risk being in a financially challenging situation because they can't afford their rent or their food, then is putting them in a very, very difficult position. And we don't want to see members working when they shouldn't be working, when they're unwell, potentially then also bringing that illness into the workplace and putting service users at risk as well. So this is something that from a safeguarding point of view is something we really want to discourage. Members as well from the migrant community are contacting Unison. We're inundated with calls to our immigration helpline. So we are offering a free immigration helpline service to migrant workers. And this is something that employers have really welcomed from Unison, because a lot of employers have fed back to us that they have migrant workers in their employ who need that immigration advice and who might be spending over and above privately to get immigration advice. So this is another benefit that we're offering to our members, this free immigration helpline, which is delivered by the Joint Council for the Welfare of Immigrants, so they can feel confident that they're getting advice from a safe, reputable source that is not going to be charging them any money for that advice. So we're getting a lot of calls to our helpline for that. And we're also getting a lot of referrals to our charity. So Unison is quite unique. We're the only trade union that has our own charity that provides welfare for our members. And the types of welfare is winter fuel grants, help with housing, school uniform costs. The list is endless, really. If a member needs some financial support, our charity is there to support them, and particularly for migrant workers who are not able to access public funds, this is a huge lifeline for these workers. So that's something we really want to encourage our members to access. Some of the concerns that we've come up against when we've been out visiting providers is that sometimes there's a lack of an adequate employee assistance program. And as the previous speaker said, the welfare and well-being of staff is so important in creating a healthy culture within the workplace. And the employee assistance program is not just about supporting the member when they become in crisis. It's about encouraging those members to access that support before they get into crisis. And that's something that we always say to members is there an employee assistance program? Have you contacted that? You know, if you are stressed, you are struggling. And often they say, I don't know if there is one. And sometimes there is when we've said, can you go and find out? But I don't know if the members are aware of what support is often available, and sometimes it's not available at all. Likewise, with occupational health, this isn't always available. And many of the members that work in the care sector, we know around 80% are female, and the majority of those are in the older age bracket, over 40. And so there is a sort of a greater chance that they might need that support if they are experiencing health issues within the workplace. That having robust risk assessments and welfare and well-being support within the workplace or through an agent that the employer uses to provide their employee assistance program is absolutely key. But this is something that Unison, we also offer this kind of support and advice to employers so that they can support their staff in this area. So when a member is experiencing an issue within the workplace, they're part of a disciplinary, a grievance, a capability meeting, something like this. We want to ensure that they have their legal right to access a trade union representative, which they should, but this isn't always clear to them. And when at the point that they are part of a formal process within the workplace, we want to ensure that those members know that they are entitled to speak to a trade union representative and have that representation to support them so that they have that support, but also it's valuable to the employer because we're able to ensure that the employer is able to support that member and help them remain in the workplace where possible with the right support and training, whatever is needed in order to improve performance, reduce sickness absence, or whatever the case may be. Some other areas that have been really popular amongst care providers is Unison's work around the menopause. So we work with a lot of employers around their policies. We have a lot of model and template policies which we develop alongside the Trade Union Congress. And these are free for employers to use. So we work with employers where we have recognition on looking at their workplace policies and making sure that those are robust and effective, and that the workers who are going to be directly impacted by those policies are able to have a voice and a say in how those policies come about and how they will impact on them. And this is really key because they're the ones who are going to be subject to these policies, they need to be able to understand them, and they need to translate into real world practice in the workplace. So working with employers around these policies is also something that we can offer, and we have a vast array of experience and a lot of model policies that we can use to support employers with making sure that they are effective. In terms of our migrant workers, we want to encourage all of our migrant members to undertake a survey that we're running at the moment, which is to understand what's going on within the workplace. Also, to all employers here, please do use the NHS's ethical recruiters list if you are recruiting from overseas, as many members have reported to us that they have been charged extortionate fees by unethical recruitment agents, and they end up in a financially really dangerous situation because they owe thousands of pounds in debt because of these recruitment agents. So please do ensure that you're only using the NHS's ethical recruiters, and please do ensure your members in your workplace, your staff, are able to access a trade union. They understand their right to be in a union and have representation and support, and use our services that are available. And please do speak to us if we can support you in improving your workplace culture. Like the previous speaker said, that's what we're about. There's sometimes a negative perception that we want to come in and cause problems, but it's not the case at all. You know, we're about supporting the members and creating a positive workplace culture where those members feel valued, have a voice and have a say, which ultimately is going to lead to a better service, as happy and supported staff are going to deliver a better service. So thank you very much for listening. I'm happy to answer any questions.
Thank you very much for that, Steph. I think it's an area that people forget, because a lot of the way social care works is that you see the managers, the owners, but you rarely see the staff. And especially when it comes to hearing about the issues, it's usually internally rather than externally. But it's good to hear the group and the major issues and challenges for the homegrown staff, and also as well as the international staff. And it's funny because we've got two fellow speakers, one talking about recruitment, home-based, and then we've also got an international recruiter as well that's going to be here as well. So I think it's a growing area, and it also leads as well to the well-being of staff and how staff are being treated. And I'll show a slide slightly later, but it all ties in as well, because CQC are looking around the areas of caring when they come to your services and inspections, and that's around the well-being of your staff, well-led, and that's down to your equality, diversity, inclusion policies, and finally innovation as well, and what you're bringing in as well. So don't just hear it from Steph in itself, but actually CQC are looking to do that, and CQC will speak to your staff as well. So if your staff are not happy or they're not having support, if you can't provide them support, have a look at things such as Unison as well. And we will be speaking with Unison a lot in the next year, 2025, because as we said, it's not just about providing, it's about also supporting the workforce, who probably are the quiet voices that go unheard. So thank you very much for that, Steph. If anyone wants to ask any questions, I mean, there was a point that was made in the chat earlier. I don't know how to take that, but I think there is also been a bit of an issue in regards, and this is home care, in regards to travel time, and a lot of local authorities may not pay the travel time in itself, which obviously means then that the provider is going to be the one that foots the bill, or in order to make ends meet, may not foot the bill. So there is probably a deeper, longer conversation to be had, whether it's at governmental level, dealing with local authorities, and maybe it's a case of actually highlighting this that will, I wouldn't say force, but definitely push some of the local authorities to understand home care, domiciliary care more often than not. So travel time is hugely important.
Okay, there's a couple of points I can add, I think here. With travel time, one of the focuses that the HMRC have at the moment is social care. Now, we could all say they're picking on social care because of the good old lower hanging fruit, but frankly, it's very easy for them to pick on social care because there are so many people not doing a very good job in social care. Local authorities and travel time. One of the commissioners that we have spoken to, they look at how they pay, and they actually pay more than the London living wage overall, but they don't pay for travel time. So when it's worked out, the employees of the dom care providers actually get more than the minimum wage, but they don't actually get the London living wage, but they are, in that sense, well supported. There are problems where some dom care providers are getting payment for travel time, etc., from a local authority, and yet they're not passing it on to their staff. So there are a number of issues here, and that actually knocks onto a very important point that Steph has raised, that James has raised, and I'm sure that Niko will raise it as well. We have meetings like this. We talk to owners, we talk to managers. Actually, much of the information that's imparted needs to go to staff. It needs to be pushed down through the pyramid of the workplace. And CQC are spending a lot of time talking to your staff, and they're not talking to them in your workplace. They're talking to them isolated remotely, so they can actually get, if you like, the truth of what those staff have been told. And this has been particularly prevalent in say, sponsored workforce. So migrant workers, they have not been given the right information. And that may well be one of the reasons why they turn to organizations such as Unison, who will give them a source of balanced, sensible advice and actually help them. And that's what's needed. And it all comes back to evidence. Communication is a key part of organizational culture. And many social care providers do have a weak organizational culture. Dudley's done a lot of work on this, as we all have over the years. It is getting better, but Unison have some very useful aspects to add to the meeting in that sense, to help people provide. And as James said, where you're working in an area, talk to other local providers, work together. You may be competitors, but there's also strength in numbers. And where we see organizations working together to, if you like, rebut what a local authority is saying, then it works much better, because they can, local authorities are large corporate bodies, they'll just pick you off one by one. Dudley.
Thank you very much. And Steph, if you want to put any information, maybe an email address in the chat, I think.
Yeah, absolutely. I just wanted to add as well, with regards to sponsors losing their licenses, we really want to encourage any displaced workers to contact their ICB international leads, because the intel we're getting is that there is a lot of displaced workers through no fault of their own, and they're not necessarily knowing to contact those international leads that are in post in order to support them. And there's a risk of that support in the future not being there if it's not being used. So we want to, for sure, encourage any migrant worker who is displaced because of their loss of the license to sponsor, to contact them. And also to remember that a lot of these care workers are in communities that talk to each other, and they're going to hear if there's bad employers and good employers. They all communicate with each other, and so you want to be the employer that they're telling their friends, this is a really good employer, you want to work here. And where we have really good employers with good terms and conditions, good employment offers, the staff are there for decades. They want to stay there, and they want to work hard and provide really good care. So we want to see that, and we see that in some of these care homes, and we want to see it more in the home care setting, but some of these workers are very, very vulnerable. They're working alone. It's dark, it's winter now, and those risk assessments, that lone working, they're at risk of abuse, and it does concern me on a personal level that they're out there doing that work without that support system and without that backup. And that's something we need to think about while they're out there doing that work.
Yeah, and I think I would just add to that if, I mean, many of you, because of your culture, because of your background, you will be in contact with sponsored workers who may have lost the company that would sponsor them may have lost their license. Local authorities have a responsibility to support people who are in a needy situation. Now, some local authorities are doing a better job than others, and some of the sponsored or migrant worker contacts within ICSs are also doing a better job than others. Some of them aren't actually that easy to contact. So if you've got any issues, then Dudley and I have got all the contacts in that sense. But we can also try and leverage any issues by perhaps talking to people at the DH. We put a rocket, or we got the DH to put a rocket up somebody because they weren't actually doing very good communications, and that seemed to work to a degree. But these people are the future, basically. Social care and health cannot carry on in most Western countries, Germany, France, Spain, UK, because we have aging populations. And without imported staff, there's not going to be any care. There's not going to be health service. So whatever the government whitters on about, we need to get more people in. And those young people are the future. Many of them are very bright. They're innovative. It's just what we need. And it's a privilege to have them here.
Thank you, Peter. Mute. Is he still there? Thank you, Peter. Thanks, Steph, for what you've done as well. So we're going to move on to, because I know time, we said we're going to finish at 12, so we'll try and fit things in as best as possible. We're going to also now move over to a bit of technology and something that helps with recruitment as well, which is important. So we've got Me Passport and they're here to speak here. I think, Carly, are you in the room here?
Yes, hello.
No problem. So the floor is yours. I'm not sure if Peter's given you permission to be one of the leads here, or you're just going to just either share a slide or just speak to us.
Yeah, bit of both. So I'll do a brief introduction, then I will.
I'll put you on as co-host anyway, so.
Fabulous. I've got my little technical person next to me who will be able to share a slide. Great. Yeah, so hi everybody, my name's Carly Rochester, and I'm one of the co-founders and directors of Me Passport. So Me Passport stands for My Employment Passport. Just to tell you a little bit about myself and us as a team, basically I've worked in social care for 26 years. Never ever did I think, you know, a few years ago that I'd be here talking about technology, because it definitely wasn't my bag. But the reality is I just got sick of dealing with problems with recruitment that sort of led to a solution. And I'll dive a little bit deeper into that because I think the story is very, very relevant. I was asked for extra care from a father, basically, for his daughter. And we'd been looking after this young lady for several years. She was in remission from cancer and had a checkup and had terrible news to say that the cancer was back in force and she had weeks to live. So I had a dad on the phone to me, telling me about his 30-year-old daughter that was going to pass away. We can turn that off. And basically, you know, they needed extra care. But at the time, I had staff shortages basically because I had people off sick, I had people with car problems, I had changes of availability, I had people with childcare issues, all of the standard stuff we deal with every day. I think it really hit home that, you know, sometimes in this job, you feel like you need to be a magician, because ultimately we're all here, I believe, to do a really good job to the people that we serve. But there's power in people. It doesn't matter how good I push a pen in an office or how good my policies are or anything like that. If I do not have the sufficient enough members of staff in the community, our services are not delivering. And the ugly truth of it is, when all of these things happen, we end up leaning on our staff that are out in the community for extra capacity. We have to think about where's the compromise in terms of, you know, whose time do we need to change, whatever else it is, all things that don't sit comfortable, but ultimately we need to deliver the care across the board, no matter what. So it was at that stage I sort of said to my HR lady, you know, where is the extra, you know, where's the staff coming through the system currently? And we had at the time around 20 care workers coming on board, and they had sort of experience up to 13 years, 15 years, 6 years, 6 months, whatever else it was. But at times they take up to 4 months to do all of the pre-vetting because of DBS checks, references, all of that sort of stuff. And I was like, do you know what? If I can travel the world on a passport that looks absolutely nothing like me anymore, because it's nearly 10 years old, why can't I build my own employment passport with all of my data verified at source and share it to gain access to employment opportunities? Because not only would that help providers have extra capacity quicker and not have to do all of these pre-vetting checks over and over again, but it will also give me access to employment opportunities and help retain me within a sector. Because ultimately as well, if I've got to go for, you know, if I'm with one care provider and the care provider is 0-hour contract, they don't have enough hours for me, and I move to another care provider and it takes me 6 weeks, 12 weeks, 5 weeks, whatever it is, to onboard to that specific provider, I need a job tomorrow. I've got bills to pay, mouths to feed, you know. So anyway, so that's my sort of lead into how I've landed with a digital platform called Me Passport. And like I said, wasn't digital at all, but just something ignited in my belly that I thought, you know what, I've worked in it long enough. I face day to day the challenges. We have a solution here that could make an impact. Let's build it. So I'll talk you through the process of Me Passport once we can get it on the screen. Right. We might need a bit of help here, Dudley.
Okay, no problem.
Is it share?
Yeah, share and
That's-
try and have a look at one of the boxes that will probably have, I don't know, that screen in there. All right.
That's us two. Yeah, that was a large version of us two. See that share button, Kate? See what's that?
I think we are, hopefully it's getting there.
Right. I'm going to
so
share
click
this.
it.
Can you see it? Have you seen the one I'm sharing?
We can see it partly. You might need to go on, yeah. Can you do, I'm not sure if you can do a slideshow, if you can.
I think it is on this one.
Yeah,
So
but if not, we can see it anyway, so you can talk us through it if you can't.
Okay, perfect. I think that's so yeah, so basically there's several ways that care workers, support workers, anyone within the social care sector can join Me Passport. One is they can organically join because it is literally a passport that is built as a digital aggregator. We don't make any recruitment decisions. We never ever bypass an interview or anything like that. We just put everything in one place for people to build on and see data. So if I organically join the passport, I would literally download it on the Google Store or the App Store, and the platform would lead me through a whole process of what I need to be or where I need to be to ensure that I meet, you know, I have enough information within my passport to meet CQC Regulation 19. If I haven't heard about the passport, then what I could do is walk into a care provider or a care home, and if they're members of the Me Passport platform, they can say to me, okay, do you have a Me Passport? No, and they can invite me to the platform. Now, in terms of HR and your resources internally, once you invite somebody to the platform, you literally do nothing else until the software tells you that that person is ready to work, and will ask their consent for them to share their full data with you. So your actual human resource element, where you'll sit there and look at a paper application form, or look at employment gaps and work them out on a calculator, or chase references, or do identity checks, you know, through a physical passport, that sort of stuff, that's all taken away from you guys. You literally will invite somebody, and the software would let you know, the technology would let you know when somebody is work ready for you to have access to their data. So next is a list of the checks that are built in, and a list of our partners that are built into the employment passport. We've linked with a company called we've linked with a company called Digidentity, and what happens with that is, to get access into the passport and to start their actual onboarding journey, the passport holder would need to be identified. So they'll need to have a driver's license or a passport, and they will also have to have a selfie and liveness check. Their passport information or driver's license information is extrapolated from the document, and it is sent to Interpol, and it goes through CFAS for anti-fraud checks. Now, the partners we have for our identity check-in service also, they verify every single UK practicing doctor for the NHS, and they also provide the identity for the NHS staff passport. We are in actual talks with the NHS staff passport, and they actually contact us for tips. So that's a big tick for social care, that, you know, we're leading on this piece of work. We also link up with, and I'll do this in no particular order, but with people's HMRC records. So if somebody has worked within the UK, we can validate that employment history at source, literally from the point of when they've got their national insurance card up to date. And then what we can do is ask for reasons for gaps within employment. So whether they was traveling, they was on maternity, or whatever else it was. If somebody has a British or Irish passport, our technology will provide a certified right to work check to give you your statutory excuse, and that is held digitally as a reusable document within the passport. If people are not on the update service, the technology will lead somebody to carry out a DBS check that is relevant to the role that they will be going in. So whether they want to be a support worker or a care worker, if they work with children and adults, etc., the level of check will be selected, and they'll be asked to go to a post office. We're linked up to the post offices nationally for them to do an in-person document check to carry out and proceed with a fully enhanced DBS check that's relevant to their workforce. We also will, from their employment history, do reference checks. These reference checks are done by our partners at Reed Screening, and basically they are the government leads on anti-fraud within references to everything. All of the data basically that's put within the passport is cross-referenced, and the references are checked both in terms of the IP address that it comes from, anti-fraud technology, and they're also verbalized to make sure that we've got legitimate references within the platform. We also link with 2,000 educational organisations globally. So if somebody has a university degree or anything like that, if they've done further education, we will validate that at source, and that digital certificate and validation will sit within the passport. If somebody is ongoing with further education as they go along in their career. All of those new certificates of further education would sit behind their reusable identity within their passport. Not probably relevant for many people here, but we also validate, we're also linked to the General Medical Council. We can validate social workers because we're linked to the Social Work England Register. We're linked to the Nursing and Midwifery Council, the Health and Care Professional Council. So if anyone has any professional memberships with those organisations, all of those are validated at source. They're refreshed every 24 hours, and that live link remains within the passport. We also link with, it used to be Grey Matter Learning, but now it's been rebranded as Flourish. We also have linked with them, and care workers, support workers, etc. Anyone within the social care space will link in with them via their passport to take their e-learning. And those e-learning courses are undertaken and the digital certificates remain live behind the reusable identity until an expiration date. So when they actually come to you and show you their data, they are showing you a full suite of validated, verified source data in order for you to do their pre-vetting or view their pre-vetting checks in under a second, dependent on your Wi-Fi speed. And then lastly, when somebody, if you have invited them to the platform, is fully compliant, you'll get a notification, they will get a notification, and they will, if they choose, they will share their data back to you. Once this is the case, you then obviously, you know, it doesn't, like I said, go outside of your interview or in your induction or anything else, any other decision you make basically to employ people. This is just all of the data you need to evidence CQC Regulation 19. The system also will do a CQC report, and what that means is basically all of the journey that somebody's been in to gain that reusable identity, the Interpol checks, the CIFA checks, the physical check within the post office, the documents, dates, what was presented, all of the employment history, the references, the training, the right to work, every single thing gets formulated in one single report, and for you to show a CQC inspector when they come knocking, basically. So I don't know about most of you, but I've spent like 20 odd years doing paper file audits every quarter for 250 files. It's took up 2 weeks of my life. And now you'll be able to do that with a click of a button, basically. What I'll say with this is, we can stop sharing this as well now. What I'll say with this is basically, we have a jobs board. So organic people that actually join the platform, they can find local providers and local job opportunities via the Me Passport job board. So if you're a provider, you can actually post jobs directly to a captive audience of all work-ready passport holders. We also have an open to work section. So what that means is, if, for an example, I joined Dudley, and Dudley as an organisation, and Dudley only had 20 hours work for me, and I needed 40 hours to sustain my financial requirements, I could let the market know that although I'm working for 20 hours, I do have a spare 20 hours to a specific availability that all of the other providers could tap into. So providers would have visibility, or do have visibility, of capacity within the market. Now, if you think about Skills for Care, the last couple of years have done, you know, the state of social care workforce reports, and what it highlights over the last 2 to 3 years, we've had nearly 800,000 people that have left their roles within social care. But 500,000 of them have actually remained in the sector, but just moved around it. And it cost the sector £1.3 billion to re-recruit people because there is no portability of records. I think it's about time that, you know, digital technology helps support some of our everyday challenges. Skills for Care also highlight that 54% of all of our recruitment come from within the sector. So we have a portable moving around workforce, but outside of Me Passport, they've had no reusable identity. So it's meant that all of us as regulated providers have been recruiting people to the same set of standards over and over and over again. And, you know, care workers or support workers or whoever it is, whether you've worked in the sector for 10 years, 12 years, no years, 6 months, whatever it is, everybody starts the same. They come in, at times they're walking into providers where they're filling out 23-page application forms, references are being sent off, they're coming back with dates only, all of this sort of stuff. And it's just like, you know, we talk to organisations that have got 3 people solely just sending out references and working out employment gaps, and it just makes no sense. So we're very hopeful that Me Passport becomes as easy as contactless payments, you know, frictionless, you know, and we bring technology to the forefront of our recruitment practices and make it easier for all, both candidates, also obviously providers, but also give the people we care for a people-rich workforce, because we are enabling people to be retained within the sector. That's about me done, Dudley.
Well done. Thanks very much. I mean, there may be a few questions. Now we're running short of time. Can you put your information in the chat box, please? Because I think a lot of people would like to hear a bit more and how to get in contact with you. I think when you mentioned 1.3 billion, even my ears turned as well. So
1.3 billion.
there you
Yes.
go. When it comes to transferring information, or I know lots of care workers, not just their DBSs and their, but also with many of the information, having a system that can not only just show you the gaps, highlight things would be really helpful, especially for those busy HR and admin sort of members of staff who have to deal with it on a day-to-day basis. So I think
No, definitely. Thanks so much, Shadi. I just wanted to just make it clear, I don't know whether I did, but the passport is built, owned and shared by our workforce. They are in complete control of what they do with their data, you know, who they share it with and all of this sort of stuff. So lots of times we have conversations with people and they talk to us about applicant tracking systems. Forget that. It's nothing to do with that. Do you know what I mean? This is about empowering our workforce to be retained within the sector and allowing us to utilise the capacity that we can't see.
Okay. And also just to note that you have been running for a while. You've been running in other parts of London and the country. So it's not something that you just thought of in your this morning, and this has been something that's really been tried and tested as well.
Yes. Yes, it has. We've been very successful across North East London, and you know, people have gone from up to 16 weeks onboarding time, and I think that, you know, if I say 2 hours, I mean, I'm over egging that, but 2 hours, they're literally having an interview, and they're being put on induction courses, because all of that data is completely there, ready for people to view it. And it's all validated at source. So, you know, sometimes in life you got to just make it make sense.
Okay. Last question, because I know we've got one last speaker to speak. Question by Alison. How much does it cost? Of course, everyone's asking, and to cost the providers to join and find staff. And also, do you do all the checks that companies provide are legitimate companies and not shell companies abroad? So I'm not sure how much of that you can answer, but yeah, this is the question.
Yeah, so I can send out pricing lists. I mean, what I'll say is we're from the sector for the sector. So we're not, this was never, there was never any desire to be like some tech entrepreneur. Yeah. Someone said to me the other week, like, wow, like you're such a, you know, it's great you're a tech entrepreneur. I didn't know who they was talking about, yeah, because my whole fundamental underpinning has been social care, being a social care provider. So it's like less than a fiver, less than a McDonald's sort of meal, yes, for access to full information. What I'll do is, Alison, I can take it offline with you and give you a full demo and answer every question that you've got.
Yeah, I think you might get more. So if you put your information in the chat box, and we'll be having them around. It would have been lovely to have done this live because they would have shown you a full demonstration on the day. But you will be able to get in touch, and something that to make sure you utilize as well. So thank you very much for that, Carly.
Sadly.
Thanks a lot. Okay, last but not least, we've got Niko Phillips, and we spoke about digitalization. We talked about recruitment as well, but we also talked about international recruitment. And there was also a question in the chat box. So I'm not going to let anyone down. And Niko's probably going to touch on international recruits, which has been probably quite a bit of a topic today. So please, Niko,
Brilliant.
the floor is yours.
Fantastic. Thanks, Dudley, and thanks to all the previous speakers. Thanks, Peter. And it's great to be here today. I'm going to take a minute just to try and figure out my my presentation. Currently, I cannot see how to do it. I'll just tell you a little bit about myself. First of all, I'm Niko, and I've been involved in supporting migrants and the migration of people for about 25 years, either as students or as workers. People looking for training opportunities, education overseas in order to improve their situation. So in improving social mobility opportunities for them, and currently working with an organization called Tern. Tern is a platform, and it's a way of matching overseas staff, either who are still abroad or who are currently here in the UK. And we talked about some of these so-called displaced workers today, and we're certainly helping to deal with their plight and their kind of sorry situation. And what it does is the platform is a very another technological solution. And what it does is it gives you an opportunity to upload a job opportunity onto the platform. A bit like Indeed, but it's one that it's not an online platform. It's one that you have direct portal access to. But it's a lot better than Indeed because we do a lot of the compliance checking and so forth that was mentioned by the previous speaker as well. So just as I'm trying to get this set up.
You should be able to share at the bottom of the screen. If you see there's a green button called share.
Yeah.
The screen. So it should come up once you share something on your screen.
Yeah, I can try that one. Let's try that. Allow to show your screen. Sorry. But yeah, I'll keep talking as I'm trying to share it. So it's a platform, as I mentioned. And so you would log in as a provider, you would upload a job vacancy, and within 2 clicks, you'll have a selection of prospective applicants with whom you can then set up interviews immediately. All of the screening of the applicants, pre-screening, documentation check, credentials vetting, and everything else is done by us and our partners. Overseas, we work with government agencies who carry out the credentials checks, check the validity of qualifications, of work experience, police checks, and so on and so forth. So all that's done. And then you can organize your interview with those applicants accordingly. I've got to do something to my system setting.
Okay. If you want, you can send me the...
It's the same one I did before, Dudley, I think. I don't know if you still got it on file. LCAS webinar.
Okay.
But let me, I can send it to you, just mindful of time.
I think I've got it. So let me just...
Cool. And so I'll keep going about Tern. So we are, as people, as I think Dudley mentioned earlier and Peter mentioned, we're on the NHS Employers Ethical Recruiters list. There are lots and lots of recruitment organisations on that list, and actually it's not very difficult to get onto. I think what makes us different is that we were conceived of, kind of born ethical. The company is put together in order to address some of the unethical practices that have been going on that you're all well aware of, particularly financial exploitation and other kind of exploitation that happens to overseas migrant workers. And so that's literally our purpose, is to try and sort that problem out.
Can you see the screen now?
Yeah, we can do.
Yeah, is to try and sort that problem out. And sorry, what was that? Was that anything for me to do?
Yeah.
No, you're fine.
Oh, cool.
I've got your presentation. Is your presentation up on the screen now?
It seems to be, yeah.
Okay, just tell
If
me
you tell us when you tell us what.
Oh, is that
when
you,
do
Peter? Thanks. If
Yeah.
you wouldn't mind going to the next slide or two. Next one, please. And the next one. Yeah, that'll be great, because I'm mindful that we don't have a lot of time. So we're really here to try and make life a bit safer for migrant workers, either those who have not travelled overseas yet, or the ones who are already here and who have been let down by maybe being sponsored by organisations that don't have their interests at heart, and have been exploiting them one way or another. What we've noted is that those organisations have since had their licences revoked. But that leaves, as Dudley often talks about, that leaves those individuals now stranded here in the UK, waiting for their letter, for their 60-day letter. And so we're doing a lot of work at the moment in building a database of such workers and those individuals. I'm going to talk about some of the benefits of hiring international staff. But before I do, and I'm sure you know better than I what those benefits are. But before I do, I just want to say that we're into a busy, coming onto a busy period here, where lots of providers are looking to employ workers on a either part-time or a full-time basis, either to sponsor them or to support workers who have the capacity to work an additional 20 hours. And we currently, as I say, have a significant database of those workers in and around London who are really looking to pick up that additional work if they can. And so I'd encourage you to get in touch with us, and we'll put the details in the comments to talk about how we can match you with those individuals who are looking to pick up extra work, and then what might the benefits be of actually sponsoring those workers full time in the future. So there's lots of misconceptions around international recruitment of international staff in care. Although here, speaking to London providers, I'm sure you're all very experienced about this and probably know this better than most. We've been touring around the UK recently into areas which don't have much experience of recruiting internationally. We all know there's a growing demand, and we know that demand, as already stated by previous speakers, is going to just be increasing, and that we just don't have the domestic workforce pipeline in place to, and I think as Peter mentioned earlier, we don't have the domestic workforce pipeline in place to solve the problem of understaffing. So international recruitment is going to continue, like it or not, and actually lots of people do like it, and there are good reasons why people like it, and we'll talk about those in a moment. Mostly we're helping people coming in from, or the majority of people are coming in from places like India and the Philippines, Sri Lanka. Those come through ethical recruiters like Tern. And then there are people who come under their own steam from countries like Zimbabwe or Nigeria, where we can't actively recruit from, but they make up a significant proportion of the care workforce, as you well know. We know that there are visas in place to help health and care workers to come across. And currently those roles, senior carers and care workers, are on the shortage occupation list, and so they qualify. And it means that in theory, those visa applications should be expedited, should be made quicker. Some of the challenges, the perceived challenges, and the challenges that you will recognise are around workforce retention. And previous speakers have spoken about retention here today. In fact, I think everybody spoke about retention. There are high turnover and burnout rates. And there are good ways to improve retention. And we're going to talk about Tern's approach to doing that. We think ethical recruitment is the only way to do international recruitment. If you're not doing it ethically, and you haven't got trust in your recruitment agency's ethical kind of approach, then you shouldn't use them. If you've any doubts at all, don't use them. And we think there are significant benefits to addressing skills gaps through foreign worker employment. And also we note that many overseas workers are already well qualified healthcare professionals. and that might be slightly different from some of the domestic workforce coming through, which is a great shame, but that's kind of the reality. And if we go to the next slide, please, Peter. Thanks. I'll just touch on some of the misconceptions around international recruitment and then just finish up. I don't want to keep you any longer than the designated time. So people think that international recruitment is expensive. Actually, when you look at it over a longer term, the picture is that there may be some upfront costs, actually not with our company, we'll talk about that in a moment. But even with those upfront costs, international recruits tend to stay, the data tells us will stay longer. And so with better retention comes a cost saving over time. The less you have to, I mean, I'm telling you, you know this better than anybody, but the less you have to do recruitment, then the cheaper the process becomes. The longer people stay with you, the more money you save. And so the contribution that you get from international recruits we'll touch on next. Foreign workers don't stay long. There's a kind of a perception that foreign workers flip between providers, and actually what they want to do is stay with one provider. They want security and stability. They've traveled halfway around the world. They've spent money, moving themselves across. In some cases, they've been exploited financially, so they've spent more money than they ought to have spent. And so for all of those reasons, they don't really want to be moving. They just want to be stable and secure and know there's income coming in, and then to remit that income back home to support their families and their loved ones. International recruits, currently the data tells us there's only a 13% turnover for international recruits, which compared to domestic staff is 32% turnover. So for every one domestic hire, you're going to have to replace them, in theory, a couple of times over a year. Whereas with international workers, that's not the case. They want to stay in their roles and they want to develop professionally because actually they've got their eye on more senior roles. They've got their eye on, sorry, someone at my door. They've got their eye on more senior roles and they've got their eye on potentially management opportunities and things like that. And that's something Tern can help with because we've got training provision in place that you can access through us to help to upskill those workers. So there are a number of training providers around and we're one of them, and Peter mentioned another earlier on, but certainly do get in touch with us on that. Look, sorry, there is someone at my door. I'm just going to be very brief. My door is right there. Just give me 1 second. I'm going to be right back.
Just before he comes back, I think a lot of providers have been looking for extra stuff, as I said, during this Christmas. So it would be helpful
about that.
to go back to people likes of Niko in looking for potential staff for this period. And I'm sure he'll be happy to discuss with you how that can work out. But can continue, Niko. Sorry.
Yeah, absolutely, Dudley. That's exactly right. And we just had a signal of the time of year. Of course, this is when the doorbell just goes constantly day in, day out, isn't it? When the Amazon parcels come. So that's exactly what's just happened to me, I'm afraid. But you're absolutely right. It's the time of year when you might be looking to pick up additional staff on a part-time basis or potentially over the longer term on a full-time basis. And that's certainly, we've got so many of these displaced sponsored workers currently in and around London who are desperately looking for opportunities to pick up more hours for various reasons. The idea that international staff provide lower quality care is a myth that I'm sure you're very well aware of. As I mentioned earlier, most of our international recruits are highly skilled and trained. They have extensive experience across a range of care settings and health settings. There are rigorous rigorous assessments and a pre-departure training course that we provide to ensure that they meet UK care standards when they come. And they often bring fresh perspectives and good practice from their countries of origin. The other final myth that we want to bust is that international workers struggle to integrate. That doesn't chime with our experience. With good induction and cultural sensitivity training, another thing that we can help with if you're not already doing that yourself, and language support programs if that's necessary, then international staff integrate perfectly well and provide the highest quality care to your service users. So we're already well over time. Those were the core messages I wanted to bring. Just to remind, Tern is a platform which can connect you to prospective workers almost immediately. Our payment terms are very affordable, and what we have is a not a subscription service, but a way of paying the commissions to our organization over time, so that we spread that payment out rather than asking for a big upfront cost. And you'll see the benefit with retention. Our attrition rates are currently 4%, so we're running at 96% retention currently, which means that you will definitely see a cost saving over time. I think I should stop there, Dudley.
No, thank you very much. There is this one question that's been asked. So I was going to answer it, but I'll leave you to sort of like. So Jackie's asked a question about what happens to a sponsorship worker when the Home Office revokes the agency license.
They're still eligible to pick up their. Our understanding is they're eligible to pick up their additional 20 hours, despite the fact that their main work has been, revoked, if you like, or the opportunity for that main work has been revoked. Obviously, what they would want to see then is that somebody will that switch. They'll want to see their visa switch from their previous sponsor to a new sponsor, so that they can remain in the UK and work full time. But in the interim, while they're waiting for their notification or their notice, which at the moment is taking quite a long time to arrive, they're eligible to pick up those part-time hours. And we have, as I said, there are lots of workers currently who are stranded and who are not able to work or to earn to have any earnings. And so we really want to help to support those individuals and connect them to employers like you, who particularly at this time of year might have a need for some additional hours that you need filling.
Thanks for that, Niko. And his information is in the chat box, and feel free. Staff needs and so forth is really important, and it also backs up what was been said by Steph from Unison. There is a raft of individuals here and actually how they're supported, so it's hugely important. Just quickly, a piece of information. I'm not sure if you're aware that LCAS have been supporting the providers and care workers, and we've been actually looking at a lot of the providers and how to manage dealing with international recruitment. And we have a session on the 10th of December for an hour. And in that session, we have a lawyer on board who will be running through how to apply and the compliance issues and how to get it right. And he'll be doing a masterclass and he'll go through it. And that will be next Tuesday, the 10th. In the chat, you can register here. So you get free legal support for once. And please do join in as well. And we'll give you some more update information as well, which is hugely important. So please do utilize it, and it's for free as well. So please do to sign in here. That'd be really helpful as well. Outside of that, I'd like to thank most people for coming. I'm just going to quickly share my screen again very quickly. Hopefully it works. So we spoke about, hopefully you can see my screen. So today we spoke about various elements about this year. We know it's been a very hard year all round. But we also must remember as well that CQC, and one of the big points that was started with James, is that CQC are really looking to inspect. And some of these areas, if you look at here, are caring in the workforce, well-being and everyone, which Steph spoke about earlier. And we talked about making sure you have and really on top of it, and it comes under the quality statement of caring. We've talked about well-led as well, which James touched upon, but we talk about the workforce equality, diversity, inclusion. It's about the workforce and valuing the diversity of your workforce, whether they're international or homegrown. CQC will be asking them as well. And also we spoke about with Carly about the Me Passport being well-led, learning, improvement and innovation. So actually focusing on innovation as well to help you with your system and your service. Some of the things that we've really touched upon today. So don't take it from me, don't take it from any of the speakers here today. Actually look at the quality statements of where it lands, and actually getting those things in place really helps you. A lot of people and a lot of providers seem to always focus on the major areas when it comes to dealing with inspections, but they forget about these areas, which are almost as equally as important, because they will catch you out on these areas around the workforce, around your innovation, and also about the well-being of your staff. So please, please, please do bear in mind of the importance of doing that in regards to that. I think there's not much for me to say apart from the event that we've got on. There is a giveaway that I've been asked to provide. There is an event happening next week on Tuesday, and it's a whole day live event, and this one's going to be in person, happening in London. This is a paid for event, but I've got up to 5 to 10 tickets available for anyone who wants them. It's a bit of a giveaway that we're providing for so if anyone is interested in this event, it is in Clerkenwell. It's from 9:30 to 5 to 4:30, and you are welcome to come. And Carly will be there with me passport, and the other speakers there on the day as well. It's got a Care Connect. It's about connecting care workers and care providers up and down UK. So you are all welcome. But if you are interested, please, I'll put in the chat, please be in touch with me, and then we can get you registered for the event. I can take up to 10, and I've been kindly asked by the promoter that can be given as a free chat. We also will be getting, I believe, Fulcrum, who are going to be probably offering up something as well. So please look out in the WhatsApp group. Peter will share that as well. And apart from that, I'll leave it over to Peter.
Okay, thanks, Dudley, and thanks to all of you for coming today. I'm sorry there was a bit of a cock-up with Croydon, and thanks very much to the presenters. There's a huge amount of info there. We'll go through the chat and pick up anything we can and follow up on things like WhatsApp. Just reiterating the point that Dudley made, I've recently written a couple of bids for local authority tenders for social care providers, and two of the questions were about how the providers looked after their staff. Nothing to do with the care that they provided. For clients, it was all about the staff. And I have to say that one of those companies actually struggled to come up with the answers to some of the parts of that. So local authorities are getting very much cuter on it, and part of that is because they are being inspected themselves now by CQC, and they are also unionised, and they're looking to move that provision sideways into the contractors they work with. The next meeting is on January the 29th, which is well after the festive season holidays. So I think it just remains for me to say, I hope you all have a good festive season and work isn't too stressful. And we look forward to seeing you in 2025.
And if you want to get a hold of us, there's the WhatsApp group number that's there in the chat. You can email Peter and I. I'd say, unfortunately, where social care doesn't sleep, nor do we. And if there are any areas or topics you want to really think about for next year, please send us a message, and we will try our best to get speakers in or connect with either local authorities, government officials, whatever is possible, CQC. Do let us know, and we'll try our best to help you out. Apart from that, try your best not to work too hard over this Christmas period, and do at least take a day off, everyone, at some point.
Righto, thanks very much. Get the rest of your day back. All the best. Bye now. Bye.